Good morning. Thank you and welcome to our press conference. This is on the Ontario government's plans to privatize additional healthcare services, including hospitals, surgeries, and diagnostics and other services. We have just started the live stream. This is a press conference and we're asking all of the supporters and observers who are on the Zoom to please stay on mute. On Facebook, welcome. You're welcome to make comments and ask questions in the chat, and we will answer them as soon as we can. For media who are here on the Zoom, we just have two speakers. We'll be as brief as we can, and then we'll open it up to questions and answers from the media. If you could identify in the chat that you have a question, you don't need to ask the actual question in the chat, just identify that you have a question. We will recognize you and you can unmute to ask your question. Thank you very much for joining us. This is the Ontario Health Coalition, which represents more than 750,000 Ontarians in a network of more than 500 organizations, including seniors groups, patient advocates, healthcare professionals, physicians, nurses, and support workers and their unions, not-for-profit organizations, ethnocultural organizations, a whole range of Ontario organizations that support public Medicare. And we have a mandate to improve and protect the public healthcare system. We have fought privatization for 50 years. We were involved in helping to create the Canada Health Act back in the early 1980s, and have fought to protect the principles of public Medicare ever since. And we are at high alert. We are deeply, deeply concerned about the message in the throne speech from the Ford government and the comments from the health minister in recent weeks as they pertain to bringing in more privatization, for-profit privatization, including for-profit privatization of our hospital services. Just to give the lay of the land to start, the Ford government has moved forward with expanding for-profit privatization over the last year, particularly in long-term care, where it has given the majority of new 30-year licenses to for-profit companies, including the same companies responsible for the deaths of literally thousands of residents in their care during the pandemic, and responsible for just horrific conditions of living and care. They have also moved forward with plans to privatize the last remaining public parts of home care. But in the lead into the election through March and April, we held 20 press conferences across the province in which we warned that the government was intending to expand for-profit hospital services through private clinics. And the government categorically denied this. The health minister's spokespeople, the health minister categorically denied that this was the case, even right through to the month before the election call. This government has no mandate, zero mandate to privatize to for-profit companies our public hospital services. At the best of times, it would be a terrible idea. In the current context in which we are facing a staffing shortage, the like of which none of us who've been involved in policy debates about healthcare in Ontario for decades have ever seen before, it is an asinine idea. It is reckless, it is dangerous, and yes, indeed, it does actually threaten the public healthcare system. So it's couched in a lot of euphemisms. In the throne speech, they talk about bold ideas and innovation. The minister keeps talking about innovation. I want to challenge a number of the things that the government has said. First off, for-profit privatization of hospitals is not new. It's not innovative. It's not particularly bold. It is a terrible idea, but it's an old idea. Private hospitals in Ontario were banned in 1973. The Private Hospitals Act was created to grandfather in the only existing private hospitals that we had in the province at that time, when the public hospital system was formalized and OHIP was formalized. And it banned their expansion and banned any future for-profit hospitals in the province. So this is neither new nor innovative. Private for-profit clinics have existed to one extent or another in different provinces across the country since the 1990s. They have had a devastating impact on public health care in Canada. And most recently in British Columbia, patients had to take the government to court for being charged thousands of dollars for surgeries in private clinics. The clinics countersued, and the forces to protect public Medicare in Canada, Canadian Doctors for Medicare, the health coalitions, fought as interveners a court case that just went to the top court in British Columbia and stopped the clinics from trying to bring down the laws that protect single-tier public Medicare in this country. So when the minister says she can privatize the ownership of our public hospital system, but we'll maintain the OHIP system where you pay by your OHIP card and you don't pay extra user fees, or you don't have to pay cash for your surgery. That is patently untrue and not supported by the evidence. The Ontario Health Coalition has called every private clinic in the country multiple times between 2006 and 2017. The last report that we did was used by the Globe and Mail for a 5-part front page series. In every single one of our studies, and they're published on our website, along with the transcripts of our calls to the private for-profit clinics, we caught the majority of the clinics selling access to healthcare for 2 times, 4 times, 5 times the price of services that we pay in the public healthcare system. The majority of the clinics violate the Canada Health Act. They charge patients in violation of Canada and provincial Medicare laws. They do bring in 2-tier Medicare. They are a potent and real threat to public health care in this country and in this province, and we will fight them with everything we have. Our message to the Ford government is, they say everything is on the table in terms of privatization. We say we are calling emergency meetings of every organization in this province that will stand up to protect our public not-for-profit healthcare and our public healthcare system. We have asked the labor movement to call an emergency meeting of the heads of unions. We're asking our lawyers to look at every legal avenue. Everything is on the table to defend our public not-for-profit healthcare system, and we will not allow, without a major fight, the for-profit privatization of Ontario's hospitals, including their surgeries and diagnostics. Right now, we have a critical staffing shortage. Every minute that this health minister and this government is spending on anything other than actually getting staff into our public hospitals, our long-term care homes, our home care, is time wasted taking away from improving and providing the healthcare that Ontarians so desperately need. We do not need bold new experiments with for-profit privatization. We need a government that is committed to governing, to actually improving the public healthcare system. We have provided a huge list, 3 pages, of concrete measures that this government could take to get staff back in, to attract back retired staff who have left during the pandemic, to get staff into the hospitals and into long-term care and home care. The government has not acted on those things and now is instead talking about handing over our vital healthcare services to for-profit companies. This is unacceptable, and we are gearing up for the fight of our lives because we understand that if we allow them to privatize the hospitals, we will not be able to protect single-tier public Medicare in this province and in this country. I asked Dr. Dick Zoutman if he would join me today. Dr. Zoutman is a hospital leader. He's been chief of staff for 2 major multi-site hospital corporations in Ontario. He's a professor at Queen's University. His clinical expertise is in infectious disease. His academic expertise is in quality improvement and hospital administration. And as one of the foremost experts in improving quality in public healthcare in our public hospitals, I welcome you, Dr. Zoutman, to talk to us about your thoughts about the comments of the health minister and the throne speech from the government. I just wanted to add one thing I forgot, sorry. actually, you go ahead and then we'll get to it in questions and answers. Thank you, Dr. Zeman.
Well, thank you very much, Natalie, and good morning, everyone. Thank you for being here. We're at a crossroads, and really it is at a crisis point. We have a crisis point in our health human resources, which we've heard a great deal about. But we also are in a potential new crisis, which is even worse, is the potential privatization of our healthcare system in Ontario. I think the privatization is not a good plan for Ontario. We should be very, very proud of our hospital and our publicly funded healthcare system in Ontario and throughout Canada. It's a unique characteristic of our country and a defining characteristic when you think of the Canadian identity, really. And to think that we would then throw that away to a for-profit money-making model it goes against the grain of what Canadians hold dear and our value system in this country. We only have to look at the pandemic and what happened. Who was it that set up pop-up clinics to get people tested? Well, it was a lot of people, but a lot of that was hospitals. I know my hospitals did. They set up endless pop-up clinics. Who was it that never turned a patient away when they were in need of care during the COVID crisis and to today when COVID is still very, very active in our society? It's our hospitals. They're always there for you. You can show your OHIP card, and even if you don't have your OHIP card, we're still going to provide you with care. Who was it that set up vaccine centers? Our hospitals. Who was it that set up COVID assessment centers? And on and on and on it went. And our healthcare workers have worked tirelessly and now are suffering the consequences of that. We're seeing the healthcare crisis. And that is not going to be solved by privatizing it, because it'll just make it worse. We need to expand our hospital system and grow our publicly funded hospital system to increase our capacity and to increase their services and our access. Ontario hospitals spend the least per person on hospital care in Canada already. We're a very efficient system. Some would argue a little too efficient. Ontario's hospitals have the lowest cost per inpatient stay in Canada and the shortest lengths of stay. We have worked very, very hard to make our hospitals as effective and efficient as possible. Again, I worry we may have gone too far. We also have the lowest number of beds per population among 22 OECD nations. That is certainly too low, and we need to really work on that. The future of healthcare is not in privatization. It is not in pocketing the profits from providing care. It's in innovation like telemedicine, like linking up home care systems with hospital systems. It's having our hospitals provide even more services in our community, working with home care and paramedics and others. For-profit private hospitals would put our hospitals in peril, because where are those people going to come from that are going to staff those hospitals? We have a human resource crisis in Canada right now because we have not attended to that crisis. No one is in charge of health human resources. There's no central committee. There's nobody in charge. It's kind of happening by accident. We've seen what happened. We have a huge problem now. If we open private clinics, we're going to be siphoning off skilled healthcare professionals into private for-profit clinics who aren't going to be there for the public hospitals, who are going to do the hard cases and are going to be there 24/7 all the time, 365 days a year to support people. We should have learned an important lesson about the long-term care tragedy. The for-profit long-term care homes were associated with a much higher mortality of our precious elders. Over 4,700 of our elders died in long-term care to date in Ontario during the COVID pandemic, which is a huge tragedy and never should have happened. And the high rate of deaths in the private for-profit homes is shocking. And yet those are exactly the types of beds that are being opened throughout and built throughout our province. It's beyond belief that this can be allowed to continue. Quality of care suffers in private for-profit healthcare. Studies have shown in American dialysis centers where you need dialysis, survive, that private for-profit dialysis centers have lower survival rates, higher mortality. They shortchange people on their dialysis runs, on the duration of the sessions, to save some money, to maximize profits. As well, I'm very concerned that non-publicly funded healthcare will lack transparency. We won't know where the money goes. Ultimately it ends up into the beneficial owners of the corporation, which are the profit holders. And we've seen huge profits being, dividends being paid out in the long-term care sector, just as an example. But it will lack that transparency and will erode our trust. Right now, when you come up to the emergency department of your hospital, I mean, you may be feeling unwell, there'll be trepidation, but you have a fundamental trust in the people that are there to help you, that they're going to help you, and that you're not going to be asked for your credit card. That will change. I want to stop there and give the mic back to Natalie. There are many examples of where for-profit healthcare is a very bad idea, is going to damage the healthcare system, and is something that we should all work very forcefully to prevent from happening in Ontario and elsewhere. Thank you, Natalie.
Thank you very much, Dr. Zoutman. So I'll just close by saying that we're demanding that the provincial government be upfront and open and honest with the people of Ontario about which exact services are they talking about privatizing, and who they have been meeting with about this, because they have not been meeting with any of the public interest groups that have expertise in privatization and the consequences of it. And I'll open this up for questions from the media. So if you're from the media and you have a question, would you indicate in the chat, and then we'll recognize you. Riley, can you keep an eye if I'm missing anyone?
Yeah, we actually have a question request from Matthew, if you want to go ahead.
Hi, Matthew Kupfer from CBC. So I'm hearing you saying that you want to hear from the Ford government where privatization may enter the system. What do you make of, I guess, it seems like your end goal wouldn't be to facilitate the Premier privatizing those things. So what kinds of commitments are you looking for from the Ford government in terms of public health care?
Well, in the lead into the election, when we held 20 press conferences warning that they were going to do just this. And, not only did they deny it categorically, they denied it up and down. They said, we are not expanding the private clinics. We are not expanding for-profit surgeries and diagnostics, period. They in fact sent their people after us and attacked us for daring to even claim that they were, and we claimed that they were because they had issued a press release giving, I think it was $21 million to expand the for-profit clinics last July. And the minister had said in a press conference in February that she was expanding the private hospitals and clinics. The ministry claimed that she misspoke, and they claimed that they weren't doing it. Now we see, that was literally up to just a few weeks before the election call. Now we're just a few, 2 months after the election. And in the throne speech, they talk about throwing the door open to bold new ideas, not allowing the quote unquote status quo to stifle innovation, and all these euphemisms. And in every, in press interviews, the minister is using a private for-profit hospital as an example of the type of privatization that she's talking about. So since it's all couched in euphemisms and buzz speak and nonsense, we would like an actual clear list of what services they're talking about privatizing. We obviously know that they are trying to privatize the next entire generation of long-term care beds in the province. We know because they changed the legislation that they intend to privatize the last remaining public parts of home care. We know because they've done it that they have cut access to public testing for COVID-19 and have handed it over instead to for-profit clinics. You can't get a test, not for love nor money in a public hospital or public health anymore. You have to go to the private clinics, and the private clinics are charging more than $200 per test for medically necessary tests. We know this because we phoned all the private clinics and we posed as patients and we asked how much it would cost us to get a COVID-19 test, even with medical need, with symptoms, with family members who are at risk. That's a violation of the Canada Health Act. The government is saying that they'll preserve the single-tier public healthcare system, but despite the fact that that has been on the front page of the Toronto Star, reported widely in the media, we put it out in the media as well, they have done nothing to stop the two-tier charges and the exorbitant charges in the for-profit COVID treatment centers. They've privatized vaccinations from public health and public hospitals to Shoppers Drug Mart and a whole array of private for-profit companies. And they're allowing Maple, which is funded by Loblaws Corporation, for-profit virtual care to charge people for access to doctor's appointments. They know that these things are happening. They're turning a blind eye to them. And now they're talking about privatizing our public hospital system. So we would like a clear list of everything that they intend to privatize, what's on the table, what are they discussing behind closed doors, and who are they meeting with? The reason why it matters is because there are all kinds of connections between this government and the for-profit long-term care industry, for example, that is profiting from the 30-year contracts that they're giving. We know that one of the vaccine testing companies, you know, the entire board gave donations to the Ford government and then got contracts to privatize those services. We know that none of the public interest groups on public health care in this province have met with the government, even though they say they're consulting on these ideas around privatization. This raises huge red flags for us about what is happening behind the scenes at Queen's Park, who they're meeting with. And, you know, is this government being run like a sign company where the premier and the minister meet with corporate friends and hand over government contracts to them, destroying our public hospital system? I'm speaking in strong terms because we're furious and we intend to mount a massive fight back against this, and they should be warned. You know, Ralph Klein called public health care the electrified third rail in Canadian politics. We intend to electrify the third rail. We will not, under our watch, allow them to privatize the public hospital system in Ontario. So that's why we want a list. We want to know who they're meeting with. It's in the public interest that there be full disclosure about this. And we want a public process. We want to force the process out into the open so that it doesn't happen behind closed doors before anybody can stop it. Any other questions? I wanted to just mention something. You know, we've talked about I don't think we were clear enough, the staffing shortage in Ontario's hospitals. It is profound. I mean, it really is the worst. I have done this. I've been the executive director here for 22 years and 5 years before that on the board. It's the worst that I have ever seen in my entire career. And pretending that for-profit privatization will help it is utter nonsense. You know, Saskatchewan, which has a terrible failed experiment with for-profit privatization of hospital services, has all kinds. They've got oncology units shut down. They've got emergency departments shutting down. They have people protesting their rural hospital emergency department closures right now. So pretending that that is going to be a solution to a staffing crisis in the public hospital system is utter nonsense. But even worse, it actually will pull staff out of the public hospital system. And we already see this in other provinces. We are short MRI technologists, CT technologists, laboratory technologists, respiratory therapists. We have a severe crisis level shortage of nurses in the province. Taking nurses and health professionals out of our public hospitals to serve private for-profit clinics that don't deal with patients who are sick. They only deal with the well. They only take the profitable surgeries and tests. They don't take you for your MRI if you're attached to all kinds of tubes and so on. You need to be able to walk in and walk out of the clinic. They don't have ICUs. So they deal with only the cheapest, the most profitable patients. They work daytimes, they don't work night times and weekends, they don't work overnights. So taking staff out of scarce staff out of our public hospitals to serve private clinics that have a business model that is about cherry picking the profitable patients and leaving the expensive patients behind with less staff and less resources to serve them is an absolutely reckless and asinine idea. It would be terrible in normal times. In the current context, it will devastate our public hospitals, and we just can't allow it to happen.
You're very right, Natalie, if I can chime in on the human resource issue. As far as I can tell, having been the chief of staff and responsible for medical human resources, nobody's in charge. There's no clear system of who's in charge and monitoring, what we need in terms of all of the people you've mentioned, including also physicians, and how many family doctors do we need, and how many specialists do we need, and how many MRI technologists and so forth. It really is tragic. And we've known that there's going to be a human resource crisis. It was precipitated and accelerated by COVID because there's been a big resign off of people saying, I just can't do this anymore. The conditions are too difficult, because we have gone too far in Ontario in terms of, trying to be efficient. And it's got to be corrected. It's got to be corrected now, but privatizing is going to make it all that much worse.
What we wish is that the Ford government would buckle down and actually run the healthcare system, run the public hospitals, actually create a health force strategy for human resources to deal with the crisis, and not just hand over the ownership and control of the vital elements of healthcare to their for-profit buddies. It's just not acceptable. And so, we're in for a big fight. We're notifying our membership, everyone on Facebook, everyone who's a part of an organization that will join in the fight. I see some of you here that run organizations that, amount to 1 million people and more. We need you, and we're going to have to fight this in every possible way. Okay, sorry to go on. Are there any other media questions? Riley? Could you, just last call then, if media could indicate in the chat if there are any more questions. Okay, so we will be back in touch with everyone about plans. The first step is emergency meetings. Oh, sorry, go ahead, Matthew.
Sorry.
Sorry, no.
Sorry, I wasn't able to chat fast enough there. I guess I just want to, you just because so much of this is kind of shifted over to the staffing side of things, and I'm wondering if you can kind of break down what you think, we're coming out of Omicron, I guess, coming into 2022. People did see some of the sacrifices that they may have made during the pandemic, when there were restrictions and so on, as preserving the healthcare system, and that now that those restrictions are gone, some people may be feeling that now the healthcare system isn't there for them. What were all of these measures that they were tolerating or putting up with or participating in, if the healthcare system wasn't going to be there for them when this is over? And I'm wondering if you can just help address that to, the people who have had their procedures deferred.
Yeah. It's been, I don't think we have sort of paused to recognize how traumatic the pandemic has been to everyone, patients waiting, to workers, not just in healthcare, but all across our society. The amount of death that we have experienced and suffered, it will have repercussions. It has around the world. The best thing that we could call for, that we have called for, is for our government to treat the health human resources crisis, the staffing crisis in healthcare, as the emergency that it is. We need to ramp up surgeries and diagnostics to clear the backlogs. People absolutely need to get in as quickly as possible. And to do that, we need the staff and the funding. The government is underspent by $1.8 billion on its planned expenditures in healthcare. That's inexcusable given the backlogs. We have a health human resources crisis that requires leadership. It requires every measure to be undertaken. And, it's not enough to say we've cleared some barriers for internationally trained nurses or health professionals to come into the province. We have a huge cadre of workers who have retired in Ontario. They need to be brought back. We need every, tool on the table to bring them back. We need the kind of emergency measures that the Quebec government took in the summer of the first wave of COVID-19, where they, for long-term care, aimed to recruit 10,000 PSWs or their equivalent in Quebec, because staffing shortages beget staffing shortages. As workload becomes impossible, more people burn out, they get injured at enormous rates, and they leave. And that's what's happened. So people have retired if they could retire. They weathered, a number of waves of the pandemic, and they just weren't able to do it anymore, and they've left. They've either retired or they've left the field entirely. That's what we're hearing from nurses and health professionals and so on. So to bring them back, we need a proper plan. What does it take? Do we need to pay the licenses of the health professionals? Do we need to provide incentives? Obviously, Bill 124 is just a slap in the face to people who've risked their lives and their families' lives throughout the pandemic, who've worked as hard as they could. It needs to be repealed right away. There's going to have to be financial incentives. The government is underspent, not overspent. There are, all kinds of ways that they could do it. It should be all hands on deck. But obviously privatization isn't, it's ideological. It's also about, who this government is particularly close to, and it will do nothing, zero, and actually distract all kinds of attention away from the task at hand, which is get the staff, get boots on the ground, get the procedures ramped up, open up every operating room that we have to maximum capacity, and push patients through and get their surgeries done. That is not happening. It's incredibly frustrating to see this. And it's so profoundly undemocratic because there's no mandate here to do this. We just had an election without one word of healthcare privatization being breathed, and all kinds of announcements about what the government was doing to deal with staffing crises across healthcare, that are nonsense, that have not actually translated into boots on the ground. So, we feel patients' frustration. We're advocates for patients at the Health Coalition. We need leadership from our provincial government, real leadership, not false promises and all kinds of announcements about money that they don't spend and staff that don't actually materialize and so on, to get boots on the ground and get the healthcare system working at top capacity in order to deal with these problems, and not to use the crisis to manipulate the public into accepting for-profit privatization, which is not about adding into the public health system. It's about taking profit out of the public health system.
If I may, Natalie, to follow up on that, our hospitals and our medical system, healthcare system is staffed with some very talented leaders who, if they, were facilitated to be able to get together to work on this crisis, the human resource crisis, we would be able to come up with remedies in the short term, in the medium term, and in the longer term to deal with this. And this needs to be the issue number one that has to have a urgent application of resources and people getting together to solve these problems, not one hospital at a time, but together, and to figure out how we get through the backlog of people waiting for MRIs, waiting for surgeries, waiting for cancer treatments. Having worked in the hospital sector, for 40 years, I can tell you the talent there is spectacular. And the dedication is spectacular, but it's not infinite. And those folks need to know that they're supported, and they will be able to help us in return. But they need to know that the government has their back, that they're going to be able to get the resources to ramp up the training programs, to pull in people who are retired, to pull in people who are available from other countries who are in Canada, driving a taxi or a truck, and who are trained healthcare professionals, as long as they're well qualified, and train them up and fill the gap as quickly as possible. And we knew this was coming. This is not news. The health human crisis is not news, and it was expected. It's been accelerated in large measure by the pandemic, and the backlog has just made it that much worse. But that should be job one of our government, not privatizing. You know, the beneficial owners of our healthcare system should be the public and the taxpayers, not shareholders.
Any other questions from the media? I know there's a lot of media here. Matthew, did you have any follow-up, or did any other media have any questions?
I was just wondering if any of the union representatives who are on this call wanted to speak to the staffing shortage issue and how it relates to today's announcement in their experience.
Let me just look and see who's here.
If it's fair to open up
Yeah, no, it's okay. I think I saw a comment from Sarah LaBelle. Sarah's a health professional, the head of the hospital professionals at OPSU. She was telling me the other day about MRI units being closed overnight because there's such a profound shortage of MRI technologists. Are you here? Sarah, do you want to go ahead? Okay, go ahead.
Hi. Yeah, sorry. Thanks so much, and for giving the opportunity to weigh in on this. I'm a lab technologist by profession. I've been working for 22 years in the healthcare system, and for 20 years in Ontario, and working alongside our partners in the Health Coalition and our community partners to defend public healthcare. And the staffing crisis that we are experiencing right now is, as Natalie has said, it is unheard of and unseen. And in fact, back in the 70s, when we were first trying to recruit lab technologists, when there was an extreme shortage in the 70s, we used to pay for their tuition and provide them access to employment insurance in order to entice people to take the program. So there are all kinds of ideas and suggestions that we could do. But the shortage of professionals right now, I know we hear an awful lot about doctors, nurses, and PSWs because we see them every single day, and you don't necessarily know all of the people that touch a patient when they come through our hospitals. But the people that kept this pandemic going, our respiratory therapists, are worn out. There was not enough of them before the pandemic, and now there are even less. They are working 3 jobs. They're working full-time in some facilities and part-time in other facilities in order to take care of all of the patients. In the height of the pandemic, normally you would have 5.8 patients per respiratory therapist in a hospital, in an ICU and a CCU. In the height of the pandemic, we were seeing 11.2 patients per respiratory therapist, which meant they were not going to be able to provide the proper care for all of the patients. And when you run for almost 2.5 years now with that many patients and trying to meet the needs and working full-time and plus part-time jobs in order to take care of every single Ontarian, it burns the staff out. And it's not, we talk about burnout, but it really is moral injury. It is when you do not have enough resources and enough people to take care of all the patients that you're seeing come through. And it is causing our members extreme stress because they're worried that they're not going to be able to save every patient that they would otherwise be able to save if they had the proper resources. So it has created significant trauma. Medical radiation therapists that that are providing treatments in chemotherapy and radiation, there's a shortage of them. MRI technologists, as Natalie mentioned, we are having to close and not run 24/7 services because there's not enough already, and pulling them out of the public system will mean even less in the public system, and there will not be 24/7 coverage. Lab
so Sarah,
technologists.
this summer, sorry, just this summer, we saw MRIs, like Ontario has ramped up its MRIs to run 24/7 so that we, address wait lists for MRIs. But you were telling me the other day that, is it Lakeridge and Oshawa and London, you've seen the MRIs being closed overnight this summer because there's not enough staff?
Yeah, we've had shifts that have been canceled because there's not enough staff. And that is across the province. It's not just in London and Lakeridge, it's in Toronto. Some of the hospitals downtown Toronto have had to, can't have their last appointment at 10 o'clock at night instead of running them 24/7. That is happening across the province. Perfusionists who, are doing cardiac surgeries and doing ECMO, we have extreme shortage of them. And it's only a matter of time before we're going to have to refer patients to outside of the province, or they're not going to get their ECMO. And it is a life-saving procedure. So extreme
ECMO
shortages
is what
across.
COVID patients need.
Yes.
When they are, in dire, when they're very close to death. Yeah. So we're short across the board. And then I think there are some nurses here. I don't know, is there anyone who is able to speak on behalf of the nurses about what they're seeing? I mean, obviously we have a very
Natalie, I can speak.
Okay, go ahead, Sandra.
Natalie.
Go ahead. Thank you.
Hi, I'm Sandra Ashcroft. I'm with UFCW's Local 175633, registered nurse by trade. And what we keep hearing everywhere we go is, of course, the staffing shortage. A lot of it right now in our sector, which is long-term care retirement homes, is being driven by staff leaving to go work in agencies because better working conditions, and of course they're making 1.5 to 2 times the wage that they make where they currently are. Many retirement homes, sadly, the rates of PSWs are not much above minimum wage. Some of them are at minimum wage, and of course, why would anybody want to work in that environment when it's getting closer and closer to being like long-term care? I can tell you one of the large hospital systems right now, up until Labor Day, is having to pay all staff who work on weekends 1.5 times their hourly rate. That's not in overtime, just 1.5 times their hourly rate because there is no staff to take care of people. Everywhere I go as registered nurse, I'm pretty much offered a job. That's how desperate these places are to hire, right? And what I hear over and over again as well is, Bill 124 certainly has not made it easy to negotiate good wage increases, but most nurses, PSWs you talk to will tell you it's not, the money's good, yes, but give me less patients to care for, give me less residents to care for. It is really frustrating when you go into work and you have 12 surgical patients that you cannot provide good care for, and you work feeling like you're drowning, knowing that you're not getting your job done to the way you want to do your job. I can guarantee you that if they brought down the nurse-patient ratios in hospitals and resident PSW ratios in long-term care, not so many people would be leaving and burned out because you would feel good about the work you did, how it used to be, not the way it is now. This was like this before COVID. COVID just highlighted it, and it's getting worse. We need more staff on the floor. We need more nurses, healthcare workers per patient ratio. That's it. I think that's the solution.
Thank you. And Pam is a registered practical nurse, and you're in Oshawa, Lakeridge. Go ahead, Pam.
Yes, hi, Pam Parks, RPN. Can you hear me?
Yes.
RPN, and also the president of QP Local 6364. Yeah, this privatization for that they announced will be devastating to healthcare workers. I worked at the Oshawa emergency up until May, until I became the president, and it is devastating. Yes, I hear what they're saying, and they're trying to sell it that the private clinics will help, but listeners out there, whoever is listening, when things happen at a private clinic, guess where they're coming? They're coming into our emerge where we already have no staff. The premier needs to quit doing band-aids and put in profit for care. They need to hire more full-time individuals. We need it fixed right now. As previous speakers have said, the workers are stretched to the bare minimum. They are doing more with less. And he needs to actually put the focus on getting more full-time individuals in healthcare, in the hospital, home care, and in long-term care, and quit giving these profits to his buddies out in the private sector. It will not help the citizens of Ontario. I cannot stress it enough. This private clinic will be devastating to healthcare. And I do implore the Premier to stop what he's promoting and please put the money into healthcare, because the citizens of Ontario deserve better. The workers in healthcare deserve better. And, you know, he's out there calling all of the healthcare members heroes. We don't want to hear that we're heroes. We want to see him fix healthcare, not for us all, but for all of the citizens of Ontario. I implore him to do that. Thank you.
Thanks, Pam. Okay, so I just, this was particularly for union representatives of healthcare workers. So I'm just going to skip you, Stuart, for the moment, and I'll open it up to everyone else once we close off the press conference part of this. Were there any other questions from media? And I note that the patient groups who are on the line are saying the seniors are the hardest hit by this and so on. I mean, obviously, yes. This is having a profound impact on patients. Any other questions from media? Okay, thank you very, very much for joining us to the media. I just want to let you go. We can continue the live stream for if we're okay for about 10 more minutes. Dr. Zoutman, are you okay for 10 minutes?
Oh, sure. Happy to stay.
Okay. Great. And we can open it up then for comments and questions and so on from the people who have joined the Zoom. And Raleigh, do you mind having a quick look at the Facebook and see if there are any questions that people need answered? Okay, so the name shows as Edward Cashman, but it's Stuart Ryan. Go ahead, Stuart. We can't hear you and you're not on mute. I'm not sure why. I'm sorry, we can't hear you, Stuart. I'm going to go to Ben and come back. Go ahead, Ben Lefebvre.
Okay, thanks, Natalie, and good presentation. I really have to wonder, where is the federal government with all of this, with the Canada Health Act and their ability to cut funding to Ontario to say, get back on track, because what you're trying to do in Ontario is ridiculous.
Yeah.
Where,
so we'll be
where
calling
are they?
on, we're going to call on the federal government to intervene around the COVID testing, where they've privatized to for-profit companies the COVID testing, and they're allowing them to, you know, to charge patients $200 or more for a test that costs $40 actually in the public system. So it's a ripoff, and it is two-tier Medicare. It's a violation of the Canada Health Act in the middle of, you know, a global health crisis. It's completely unacceptable. So we'll be calling on the Trudeau government to intervene, and on the Ford. We have already called on the Ford government to stop it. They're not stopping it. So, but yeah, you know, we need the federal government to intervene. In British Columbia, in the court case that the private clinics brought to try and bring down the single tier Medicare in Canada, the federal government was an intervener on the side of protecting public health care. They do claw back funding from the provinces where the provinces are allowing for-profit companies to charge patients directly for care. However, they are not independently researching it and doing it enough by any stretch of the imagination. You know, this is a question of political pressure. And, you know, I think what's happened is that the Ford government is banking on the fact that Ontario will allow them to do what Saskatchewan is doing and other provinces, but they have not, you know, we are not Saskatchewan. We are not going to roll over and let them privatize the hospitals and let them bring in a raft of private clinics that are really private hospitals and so on. You know, they're going to face the fight of their lives over this here. But, you know, yes, it is happening in provinces. It shouldn't happen. And there should be a massive fight back from Canadians. And I should note that the prices they're charging, I mean, they deserve exposure. Like where we found the cataract surgery clinics charging patients, they're charging $200 for a medically unnecessary eye test. OHIP covers the medically necessary eye measurement tests for cataract surgeries. So the owners of these for-profit clinics tell the elderly patients, oh, that, you know, that's the, Ford version, you need the Cadillac, and, you have to pay, and who's going to say no to the person who's going to operate on their eye? So they're charging people on a fixed income. These are some of the wealthiest people in Canada, the surgeons. They make literally hundreds of thousands of dollars a year. 600,000 was the last figure I saw 10 years ago as the average for ophthalmologist billing of OHIP. That doesn't count the extra fees, charging, fixed income people these prices. And then also a whole array of them are charging $2,000 to $3,000 for cataract surgeries in violation of the Canada Health Act, something that costs the public system $550 per case. The private clinics are charging $1,000 to start for an MRI, something that costs, when they ramp up MRIs in the public hospitals, $250. I mean, it is unbelievable the extent to which they drive up costs, take staff out. There's just nothing good about them. So we have to push. We're going to have to push, and we're going to have to push the federal government as well. But I mean, I don't want to distract too much. The delivery of healthcare, the upholding of the Canada Health Act, the stopping of user fees for patients is a federal responsibility as well as a provincial responsibility. We have Ontario laws, the Protection of the Future of Medicare Act in Ontario. We have the Canada Health Act that bans all of that. But I mean, the way to protect it is to stop them from turning over the ownership and control of those services to for-profit companies. Once you turn it over, you have to catch them violating it. Then you have to mount the massive political fight to force the federal government to uphold the act in the province and so on. I mean, the better thing to do is just to stop them from turning over those surgeries and diagnostics to for-profit companies in the first place. And that's what we'll fight to do. We fought to do it under, since the Mike Harris government started this, hardly new. And we have been successful, and we'll fight to do it again under this government.
Natalie, you're absolutely right, if I may add in.
Yes.
The notion that healthcare is a provincial jurisdiction, the federal government has nothing to do with it, is nonsense. I think we all realize that. A substantial portion of healthcare funding comes from the federal government, and a substantial amount of the the legal environment that supports it, particularly the Canada Health Act, is federal, and it's up to our federal government to defend public healthcare, because it's the provinces who are being squeezed and are trying ways to save money. The federal government needs to set the standard and defend Canadians' right to publicly supported healthcare, and to ban privatization outright, as they have tried, and we're just finding loopholes and ways around it that is to everybody's detriment. So I believe our government, our federal government, can also play a role, and also on the health human resources. This is a Canadian crisis. It's bigger than Ontario. We're talking about Ontario today, where it's very obvious that it's a problem, but it is across the country.
The other thing I should mention is that, these same provinces led by conservative governments that are privatizing the control and ownership of our healthcare services. And I say that not as a partisan, we're not partisan. We oppose any government that's going to privatize healthcare, and we support, policies that build capacity and improve care in the public, not-for-profit healthcare system. But across the West, where we see governments privatizing healthcare services, they're the same provincial premiers who are demanding more money, billions of dollars more money from the federal government with no strings attached. Yeah. The same provinces who have seen horrific levels of death in for-profit long-term care homes and have not actually taken the measures that would be necessary to ever be able to regulate those for-profit players in long-term care homes, talking about, privatizing more services and allowing two-tier charges for patients, not acceptable. The federal government needs to stand firm. And, if they're going to give more money, and we support that, to the provinces for healthcare and restore the level of federal funding, it must be attached to clear accountability strings that require them to protect the public healthcare system and not shunt it out the back door in like, as we've seen in long-term care, tens of millions of dollars literally per month taken out by for-profit companies, even as thousands of the residents that they were responsible for died in squalor in their homes. Not acceptable. The fact that governments would do this in the midst of a pandemic is just disgusting. It's appalling. Thank you. Riley?
We have a question from our Facebook Live. Lewis is asking that she gets the impression that overall Ford does not want to fix the problems. Why do you think he is going in this direction?
Well, I mean, in long-term care, there are, what is the word? There are a vast number of close connections between the Conservative Party and the leaders in the Conservative government and the for-profit long-term care industry. You know, governments are closer and further away from different groups of companies and different interests. This government has given many contracts to companies, that even sole source contracts without competition, to all kinds of companies. And they have met with all kinds of for-profit healthcare companies. You know, I mean, frankly, these are business interests, right? They want to, in every developed nation, healthcare is about 40% of GDP, or was prior to the pandemic. It's billions of public dollars, guaranteed streams of revenue. And it's like an oyster that the for-profit industry wants to crack open and take some of that money for themselves. And so when you have a government that is close to and meets with, you know, proponents of for-profit, you know, healthcare industries, or industries that want to expand into for-profit healthcare, like Loblaws and Shoppers Drug Mart and Maple and so on, then, you know, and suddenly they, you know, are turning a blind eye to those companies, charging patients two-tier user fees to maximize their profits in violation of the law, and so on. I say, you know, draw the lines between them yourselves. You know, we have successfully fought off private for-profit companies trying to take over the hospital system on multiple occasions in Ontario. This is an old idea. It keeps coming up. We live next to the largest for-profit healthcare industry on the planet. And there is constant pressure to hand over our public healthcare system to private for-profit providers. We expect our governments to protect the public interest in these things. And that's why we're demanding full public disclosure. Who are they meeting with? Who are they consulting? It's certainly not public interest organizations. You know, ultimately, we want them to act in the public interest here. Okay, sir, your hand is still up. Do you want to try and speak? And if we can't hear you, I'm afraid we're going to have to give up for this call. Sorry, my dear, I'm sorry, we just can't hear you. So is there anyone at Barb? Hogg, go ahead.
Hi everybody. Thanks for all of the work you've been doing. I'm just going to throw out this comment because I think I'm going to try and make it quick here. Okay, I think we need to get across the message to the public because I think a lot of the public are going the way of feeling that they might want the two-tiered health system. Because a lot of people have money and a lot of people are wealthy and they think, why not? So I think there's going to be a big problem. I'm thinking we are living in a more selfish society at the moment, and you can see this when you're driving and we have high gas prices and people aren't slowing down, and they're not, I just don't think they're thinking of the collective. Anymore. I'm seeing a more selfish society happening. So I think I think we're going to really have to concentrate on how to get the message across to the people that think that they're okay. This I'll be okay. That's what worries me. Thanks.
You know, every poll for decades, including recent polls, the vast majority of Canadians support single-tier public Medicare. They support the foundational principles of equity and compassion that underlie our health system. I do think we, we are facing a period in which people do sometimes jump over each other to get to the front of the line and so on. But I mean, but deeply held values across Canada are that healthcare should be based on your medical need and not your ability to pay. I think people who don't have a realistic understanding of how much for-profit healthcare costs may not realize that they would never be able to afford it. That's why every industrialized country in the world has public health care, because you can't afford it. And particularly when you're elderly, when you're most likely to get cancers, to get sick in the last few years of your life before death, most people are on fixed incomes and cannot afford exorbitant healthcare costs. But I already told you that the for-profit clinics are charging 2 times, 4 times, 5 times the cost of services in the public healthcare system. We all pay more. Wait times actually go up, not down, when they bring in for-profit clinics. The evidence is clear from across Canada. And if you are so selfish that you want to jump the queue, don't think that it is without consequence, because you jump the queue and you push someone else further back in line. That's what happens. And so I think we do need to have that discussion, but I think Ford is banking on the idea that Ontarians will think that, well, first, I mean, they're announcing these things in the middle of August. Most Ontarians aren't even watching, right? They're banking on the fact that they've done this in the dead of summer, and it'll be a fait accompli before anyone wakes up to it. So it's our job to stop that. And secondarily, that they're going to couch it in so many euphemisms about innovation and big, bold ideas and all that nonsense that people won't actually understand what they're talking about. If they weren't worried, they could be much more straight up about what their plans are. So they are actually worried about it. They wouldn't have denied it leading into the election if they weren't worried about it. Our experience is that for-profit healthcare is full of conflicts of interest, full of secrecy, full of secret contracts, exorbitant prices, worse staffing shortages, worse care for the majority of people, and so on. Every single one of those pieces of evidence, of those arguments, is effective. The issue is getting them out to the public. Now it's 11:32, so I'm sorry. I think we should probably call a major, not a press conference, but just a major meeting of all of our membership to have a further discussion and answer more questions and so on about this, because I think we would like to spend time sort of going through everything that everyone needs to know and gearing up for the major fight ahead. But I think we better close this one down because we've been more than an hour now. And I just want to thank all of you for joining on Facebook, all of you. Thank you for joining on the Zoom, the committees and local coalitions, the community reps and the workers, the unions, the health professionals, the nurses, physicians, Dr. Dick Zoutman. Thank you very much for lending your expertise in this. This is obviously just the very beginning of what is going to be the fight of our lives. Our read of this is they're very serious about their intentions here, and we are going to need to pull out everything we can. So we'll be back in touch over the next few days about pulling together emergency meetings and then ratcheting this up to make it impossible for them to do. Just a heartfelt thank you. And for all of you who've advocated for so long to protect patients, and I'm sorry we had to do it again, but we will win. We always have, and we will again. Thank you. Bye-bye, everyone. So Riley, you can